All right, let's dive into something that's incredibly common, but something people rarely want to talk about: anal fissures. If you've ever dealt with this, you know exactly how painful and just plain frustrating it can be. So, in this explainer, we're going to cut right to the chase: what they are, why they happen, and most importantly, how you can actually find some relief. Look, our goal here is to be really direct and clear. Why? Because actually understanding what's going on with your own body is always the very first step to feeling better. So let's start breaking it all down. Okay, first things first. What exactly is an anal fissure anyway? So the clinical definition you'll see is a linear ulcer, but all that really means is it's a small, painful tear in the lining of the anal canal. The most important thing to get your head around is that this is a straightforward physical injury. It's not some kind of disease. So why does this even happen? Well, the tear usually pops up in a really specific spot: the posterior midline. Just, think of it like the 6 o'clock position on a clock face. And the reason is simple. The tissue there just isn't as flexible. It's usually caused by the skin stretching from a hard stool, but it's really worth knowing that even prolonged diarrhea can trigger it too. Now, this next part is probably the single most important thing to understand, because it answers the biggest question of all. How can such a tiny little injury cause such a persistent, ongoing problem? And it's a totally fair question, right? I mean, a small cut anywhere else on your body, it usually heals up in a few days. So what's so different about this? The answer is this really frustrating, self-perpetuating cycle. Here's how that cycle works. It's pretty simple, actually. First, the tear itself causes pain. That pain then triggers a reflex spasm in the anal sphincter muscle. This spasm is super intense, and it constricts the blood vessels, which, you guessed it, reduces blood flow to the area. And without a good blood supply, the tear just can't heal properly, which just leads right back to more pain. It's a classic vicious loop. And this cycle is what directly leads to all the classic symptoms. The pain and the fresh bleeding, that's from the tear itself. The constipation often gets worse because that muscle spasm makes everything even more difficult and painful. And in cases that have been going on for a while, a little skin tag, sometimes called a sentinel pile, can form right at the edge of the fissure. Okay, so now that we get the problem, let's talk about how to fix it. And here's the good news. The path to healing is actually really clear, and it starts with simple, non-invasive stuff. The entire goal of any treatment is to break that pain spasm cycle we just talked about. And you do that with a two-pronged attack. First, you avoid any strain. That means a high-fiber diet, maybe some stool softeners. Second, you directly relax that muscle. This is where topical ointments like glycerol trinitrate, or GTN, come into play. They help relax that sphincter muscle, which restores the blood flow and finally lets that little tear heal up. So, you might be wondering, how well does this first-line approach actually work? Pretty darn well, it turns out. The success rate is right around 75%. Think about that. For 3 out of 4 people, these simple changes are enough to solve the problem completely. But what about that other 25%? What if the fissure is just really stubborn? Well, for those cases, there is a clear, step-by-step ladder of advanced options. And this isn't about failure. It's just about finding the right tool for the job. The treatment path really is like a ladder. If the ointments and the diet just aren't cutting it, the next step up might be an injection of botulinum toxin. It works on the exact same principle we've been talking about, relaxing the muscle to improve blood flow. It's just a more targeted way of doing it. Surgery is only considered if that still doesn't provide lasting relief. So let's demystify the surgery, because the name, lateral internal sphincterotomy, sounds way more complex than the goal. The goal is actually very, very simple. A surgeon makes a tiny cut in the sphincter muscle, but, and this is key, away from the tear itself. This permanently reduces that spasm, restores the blood flow, and allows the fissure to finally heal up for good. So when you put it all together, what's the most important thing to take away from all this? It's that this is a solvable problem. As we saw, the vast majority of cases heal with really simple steps, and for everyone else, there's a clear, effective path forward. The key message here is really one of control and of hope. So let's just do a quick recap of what to remember. 1, it's a simple physical tear, not a disease. 2, that pain spasm cycle is the real enemy here. That's what stops it from healing. 3, simple conservative treatments work for about 75% of people. And 4, for everyone else, there are targeted medical options that get right to the root cause